everybody, welcome to the first rehab with CEO, how to basically self-rehab when you're self-isolating. So I decided to do this little series of videos just to show that even if you're concerned about little niggles and pains and you're not able to get out and about, there's always something you can do at home to look after yourself and keep you ticking over until you're able to see somebody for treatment. So I'm going to keep this pretty casual, kind of like how I am in clinic. I'll try not to be too scientific. I might throw in a couple of words there, but don't panic, I'll explain it all. So, as you can see behind me, I've got Sid, who you've seen in clinic, deconstructed, so we'll kind of talk about him and the gadgets and gizmos I've got to show you how to self-rehab, basically. The gadgets and gizmos I've got, they're really cheap. I just want to show you that you don't have to buy expensive equipment to help get yourself better. I've got a technique I'm going to show you how to use with a teaspoon. So everybody has a teaspoon kicking about somewhere at home. You're going to be able to get through this self-rehab and it'll be fine. So the little series of videos, there's probably going to be about 5 of them. I'm going to start tonight's one with head and neck. Then we're going to do our shoulder, hands and arm. Then an abdominal and a back, pelvis and upper leg. And then we're going to finish it off with a lower leg, ankle and foot. So if you've got any questions, any queries, any burning questions you want me to answer, let me know and I'll add them as the series goes on. This is the first time I've done anything like this, so if you guys are finding it helpful and it's really popular, I might do a little bit more of it. Any tips, tricks, anything you want to tell me to make these better, I'd really appreciate that. So I wanted to start with the head and neck first because there's been a huge rush of this self-isolation and social distancing, and a lot of people who would normally work in an office are suddenly kind of stuck at home, stuck probably at their dining room table with a laptop, hunched over, not looking after themselves and probably not taking the regular breaks they would normally be taking at work. So I thought that'd be a good place to start, and then we can work through the body as the weeks go on. So kind of how the sessions are going to run, a little bit of brief anatomy just to kind of get you an understanding of where we are, and then what dysfunctions can occur, and then how you can try and help yourself with these at home. So I hope you enjoy this, and just give me some feedback at the end of it. So don't be too mean though. Thanks. So this is Sid, like I say, who some of you will know from clinic. Sid's been a little bit decapitated. So head and neck, really simple. This is your head, this is your neck. Heads are really heavy. They're really heavy for these little structures to keep you upright. Not great design. So your cervical spine is made up of 7 cervical vertebrae and this little hyoid bone on the front. Now the biggest thing I kind of chuckle at in clinic is people think the spine is a 1D object, but really it's a rod. It has a front, an anterior side, a posterior side, and 2 lateral sides. So we can't just concentrate on one side. You have to take all the aspects into consideration. So, like I say, just really basic anatomy of the spine, or of the cervical spine. So your neck, you've got C1 and C2. They're quite different types of vertebrae compared to the rest of the cervical spine. They've got quite a different function from the other ones. And like I say, you've got this little hyoid bone on the front. Now, with your head on top of the spine here, you have a lot of muscle attachments on the back of your skull that attach on to all the little bony bits at the back of your neck. They also attach on the little bony bits at the side of your neck. There's a muscle, your sternocleidomastoid, or as I like to call it in clinic, your Deirdre Barlow. And if you ever watch Coronation Street, you'll know what I mean when you know the character Deirdre Barlow. But your sternocleidomastoid starts around here, give or take, and comes onto collarbone. So, if you're having an issue with your shoulder, you might be having a problem with your head. Or if you're having a problem with your head, you might be having a problem with your shoulder. So just because you're having pain in one area doesn't mean to say that's where the problem is. It can be coming from somewhere completely different. And I love doing work on Deirdre Barlow in clinic, because it provides so much relief for people. It's a muscle that can really cause a lot of havoc. So that's my teaspoon exercise for later on. So definitely pay attention to that one. Excuse me. So just the way I work, everyone works a little bit differently. I always like to work on the anterior side of the neck first, as opposed to the posterior side of the neck. Just preference, every therapist is a little bit different. Loads of people complain of stiffness and tightness all at like the base of that skull, just where your head sits on that C1. But what you tend to find is so many people are desk based these days, or they have a long commute to work, either on the train or in the car, that when they're sitting and they're driving or sitting at their desk texting or doing loads of work at a computer, their head comes too far forward and they're looking down. And what actually happens is you get a lot of tension coming down the posterior side of the neck. And what's actually happening is, all because of the weight of your head, this is all getting too long, and this is this tension you're feeling. And what's actually happening on the front of the neck is everything's getting far too short and very, very tight. So a problem with the front of the neck and really tight is people have like a tickly cough. People are having to clear their throat all the time. Or what I've seen a lot recently in clinic actually is people having swallowing problems. People complain about food getting stuck. Not having a fully blown choking incident, but food definitely getting stuck. And that tends to be quite a common problem for people who tend to be in the manual industry. Sparkies, plumbers, brickies, joiners, that kind of thing, where they're working in confined spaces, they're bending down into intricate work. So that's a really complicated area, and that's quite good to release off. So other general problems that can come with the neck: headaches, migraines. Another thing that can be really bad in the head is TMJ problems. So like clicky jaw, grinding of teeth, that all kind of wreaks a little bit of a havoc with people. And some of these things are really, really easy to resolve. You just have to think outside the box a little bit. So hopefully tonight I'm going to show you some of these things, and you'll find it really helpful. And like I said, they're not expensive. I'm just going to put it out there right now. I'm not on a commission to promote any of these products. I just really like them. Some therapists don't like them. Some therapists are a bit ambivalent about them. But I really like these, and maybe it'll boost the teaspoon industry a little bit. You never know. So let's get cracking with some of these, and I'll kind of just show you a sort of maybe 5 minutes or so, maybe a wee bit longer. I don't know how long I'm going to ramble on for. We'll see what comes to my brain. But it'll just be like a sort of nice start at the top of your head, work through your face, anterior work, and then into some posterior work, and hopefully you'll be a little bit less sore and tense whilst you're all self-isolating. So I hope you enjoy the rest of these little techniques. So the first couple that I have is Shakti mat pillow, not just for necks. You can use this on adductors. I'll show you that in a later video. I actually really like it for adductors. Great if you're desk bound or doing a lot of gym work, but we'll play around with that in a little while. Really, really good for neck and adductors. And the people who come to clinic will know this little green ball very well. Franklin ball, you can get it on Amazon. Just type in Franklin green ball, you'll get it. It's like 20 quid or something. Really, really nice little gadget to have. Typical spiky ball, comes in a variety of sizes. Knock yourself out on Amazon. Then my famous butter knife. It's not actually a butter knife. It's called iastum, very similar to Graston technique. Instrument assisted soft tissue mobilisation, but people come see me know it as the butter knife. But the replacement is a teaspoon, so you don't need to buy one of these, just get yourself one of these. So we're going to start a little routine and see how we get on. So I would kind of do most of these lying down. You're not going to see some of the ones that I'll be doing be able to see if I lie down. So I'll do some sitting up, but I'll tell you when you should be lying or sitting for these techniques. So a nice little one to start with is just getting your two thumbs together, starting them in the middle of your eyebrows, and just like say, do this one lying down, just a little bit of pressure and just kind of sweep up and over your eyebrows. Look over so you guys can see that a little bit better. So middle eyebrows and sweep up and over. And you can, I hope you can see, because I can kind of see it on the video, you can just about see the sort of change in colour as I press through the skin as the blood's just kind of moving a little bit. So that's a really nice one if you're sitting at a desk all day staring at a screen and just moving over this frontalis muscle. So frontalis muscle is just pretty much your forehead, covers your forehead. It's about here, and then all the way back to the back of your head, there's a big band of fascia, and then all the spinous capitis muscles come off the back. And actually, it can get really, all this can get really tight if you wear a ponytail all the time, like I do, or your hair up in a bun. It just gets tight and pulls a lot. So it's really nice to just release this as you're lying on the sofa, in bed, probably just like a soft pillow just under you, just to work all through that. What you can also do, and please don't laugh too much at the funny faces I'm going to make, is you can do a little pin and stretch technique. And I've actually not done this for a while, so I might do this a little bit more with people, mostly because they just think I'm taking the mick, and I'm actually not. It's genuinely a legitimate technique. And what you can do is you can pin different aspects of it. So you can do like 4 fingers, you can do thumbs, you can do 1 finger, you can change the position of where the fingers go, and you can just hold it and raise your eyebrows and make funny faces. And by pinning it and stretching it, you're getting a nice little release through all that as well. Another nice little technique to do is using your knuckles on your cheeks. Massively overused muscles of the body. People don't think of their cheeks being that overworked. But think how many times in a day you speak to someone, you have a sing-song with your children, you're eating, you're drinking, you're laughing. Massively, massively overworked. And if you've had maybe a knock to the face, whether it's been a punch through contact sport, or you've had a trip and fall, broken nose, anything like that, this all really becomes very dysfunctional. So what you can do is either using like a facial cleanser, baby oil, facial moisturiser. I've got a little tub of wax, but you don't have to buy wax, you've got stuff at home. Olive oil works really well because it's really good for your skin too. Just a little bit on the knuckles, and what you can do is just gently massage through those muscles, and that'll start to give you a little bit of relief on that jaw joint. I love jaw work. People who come see me know I love getting the gloves on and getting in and working through people's gums and palates and their cheeks. And I'm getting a lot of people with clicky jaws, so quite often I would do some dry needling into people's cheeks, but you guys can't do that at home. So a nice little thing to do is actually just gently palpate just off the side of your ear. I'll show you a sit. So this, think of your ears being about here, just off a little bit. You'll feel a little divot, and you want to see if they're the same. So you can see on mine, there's quite a differential between my left side and my right side. And like, I can see it, my jaw is kind of way off to this side. So what you can maybe do is find which divot feels more indented or more, I guess, outdented. It's too far out, and you can have a little play around with that. So kind of just give it a bit of a wiggle. Like, there's not a massive exact science behind it. Well, there is, but for all intensive purposes, there's not. So just give it a little bit of a wiggle. And what you can do, excuse me, is hold your chin and just gently try and open your mouth. It's not a huge amount of effort. Again, people who come to see me, I'm always telling people to be gentle. Like, I want you to just think about moving it, because by the time you've thought about moving it, it's actually already moved. You've already had that signal to your brain to open the arm up or open the jaw up. So like say, you can just rest your chin on your hands, and all you want to do is just think about opening your mouth. So from here, and then just let it go, and let it go, and let it go. And then what you can do is you can go side to side. So it's not just about kind of moving your lips, it's actually out moving the jaw side to side. So on me, I would say my right side jaw is a little bit tight. So if I want to release the right side, I need to take my jaw to the right side and then resist it to the left. And that's just going to give a really nice gentle stretch to there. So really good for teeth grinders, people who are always sitting like at their desk with their hand on their mouth and contorting that a little bit. People who've had a lot of traumatic dental work, that can cause a lot of head and neck problems. Whether you've had a lot of teeth extractions or a lot of braces or long brace use or a lot of abscesses, just that can cause a lot of problems. So like I say, excuse me, if you take the jaw to the right and you're just going to resist it, pushing it back to the left, don't push too hard. You don't want that huge shotgun ricochet effect. So like I say, just off to the right and just gently push it back. And each time you want to take it a little bit further than the time before. So again, if we go to the left and just gently push it right, I don't really need to do it so much to that side, so I'll not go as hard. And you'll feel a little difference. Just go back and give it a poke. In fact, actually, that has probably leveled it up just a little bit. I'll probably go stick some needles in this later. Been talking too much clearly today. So that's kind of some really nice stuff just for your face and head. If you've been grinding a lot, stressing about COVID-19, suddenly in a new desk position at home, that's all really, really, really nice for that. What you can also do, kind of like the 2 thumbs across your forehead, 2 thumbs underneath your chin, and just follow that jawline all the way up to your ear. And that's really, really nice for just releasing some tension through those little front neck muscles. These are really, really neglected. Like I say, especially if you have a constant dry cough, it's probably all of this that started to be a bit bothersome for you, and that's what's kind of causing your issues. The muscles down the front of the neck can also give you breathing problems, so I'm just going to show you on SID in a little second. You have scalene, so other than your Deirdre Barlow, which is going to be involved in that jaw dysfunction, scalenes on the front of the neck come onto ribs. So if you are and scalenes are involved in accessory breathing muscles. So if you potentially have a lung sort of condition like asthma, all this is working really hard and attaching on here. So your neck might be a problem because you've got asthma, or your asthma might be a little bit worse because your neck is really tight. And just to kind of demonstrate that, if you imagine sort of front aspect, these kind of lower vertebrae here attaching on to ribs 1 and 2, if that comes forward, this might not work so well because he doesn't move that great. If that comes forward, anytime you bring the start of a muscle closer to the end of a muscle, it's going to shorten. Oh, this is something I wanted to say earlier, just reminding me. So anytime the insertion, or the origin of a muscle comes towards the insertion point, so the start of the muscle comes closer to the end of the muscle, it shortens and it gets tight. But that then means everything on the back, so the opposing muscles, then get longer. So you've got to differentiate between something being tight or something being tense, because it's actually too long. So when the origin of the muscle comes closer to the insertion, it shortens and it gets really tight. But that is the same sensation in the body as when the origin of the muscle becomes far away from the insertion, and you get a lengthening and you get tension. So that's like any therapist's job. They have to figure out if something is too tense and it's working too hard and it's too long, or if something is too tight and it's actually too short and it's been a bit lazy and not doing very much. So back to breathing and necks. If these scalene muscles, anterior, medial and posterior, get too tight and they attach on ribs 1 and 2, they will start to pull up. And I'm not quite sure if you can see that. Sid doesn't really move that great. He's not a great demo, I'm afraid. But as these tighten up and pull, you might see that a little bit. This collarbone starts to come into play, which can then give you this shoulder dysfunction. So it's never quite as simple as, oh, I've got a bit of a swallowing problem, or I've got a little bit of a tight throat because I'm coughing, or I've got a jaw problem, all these things can really cause a lot of issues elsewhere. So I'm going to get my teaspoon out and I'm going to show you how to do some Deirdre Barlow work to try and help with any jaw problems and to start working into some breathing problems. Again, I would probably do this lying down, but I'm just going to have to do it sitting up to show you guys. I've kind of not thought about the logistics of this just yet with this first video. So in clinic, like say I would have you lying down. I would normally be using my little butter knife, my iastom tool, but I'm gonna quickly show you with a butter knife and then I'll show you with a spoon. So I've just got a little pot of wax. Depending on how oily your skin is, you might not need to use any wax, so just see how it feels. You can actually use your fingers too, but sometimes it's just nice to just have a little gadget just to take the pressure off your hands a little bit. So like I say, you don't have to use wax. Olive oil, skin cleanser, facial moisturiser, it's fairly easy going. So you kind of just want to come to the kind of just below your ear, side of your jaw, down towards your collarbone. So if I was in clinic using my doodah, you want to just find that little notch at your collarbone, and I would hook onto it and I would just gently work up the length of the muscle. And what you can also do is you can hook it and you just get to turn a little bit, and that's a nice little resisted movement. You can easily do it with your fingers as well, hook into it, same thing, work the way up, or hook and do a little turn. And like I say, it's the exact same with your teaspoon. Take the flattened end at the bottom, not the patterned end, flat end, and lay it on just above the notch. And you just want to do a really nice little rotation. You don't have to be an owl, you don't have to go all the way, just a nice little rotation and work all the way up the muscle. It's really, really simple. Self-care doesn't have to be difficult. Another thing you can do, and I quite like doing this in clinic as well, is having someone turn their head off to the side, and I'll take my little butter knife and from the side of the head just gently pull and work down towards that collarbone. But again, you can use a thumb if you really want to. Sometimes I use my thumbs, it depends on how tight somebody is or how tired my hands are that day. But then teaspoon's your friend too. So you might even want to use a soup spoon or a cereal spoon if it's a little bit longer. Just kind of see what works for you. Depends on how big your hands are, depends on how big your spoon is, and depends on how big your neck is. Just on the edge there, and you just gently drag it down. You don't have to be beating yourself up. Really, really simple. Be gentle, and everything will be fine. So that's a really nice little treatment for, like say, your SCM, your sternocleidomastoid, or Deirdre Barlow, as I like to call it in clinic, just because the Coronation Street character, she is very protruding SCM. So that's a nice little one to do. Again, another one to do lying down is just to work through all this bit in here. So this is like I say, an issue for people who've got a kind of constant having to clear their throat sensation, or they're having issues swallowing. So back to Sid for a second. Like say you've got this little hyoid bone. Some muscles of the neck attach onto it and then further attach elsewhere. Some of them just pass through it or pass over it, and that can all just get really guddled in there and just really congested. So again, something I quite like to do in clinic, and I always promise the person someone's not paid me more to do it to them because they think I'm going to strangle them. I'm not strangling anybody. You just pin one side. If you just give yourself a little feel, you'll be able to feel it. It's just kind of floating around in there. So you want to pin just above it. Pin just above that little bone with a couple of fingers, and then with your other hand you can just gently push into it and just mobilise it a little bit. But you don't have to be too rough. Like I can still hold a conversation with you whilst I'm doing this, and then just move it down a little bit further and kind of go again. Like so you would do this lying down. It's a little bit more difficult to do it sitting up. The muscle's not relaxed enough to be able to do it, to get the full effect of it. So you would definitely do this lying down. It's actually quite nice to do it lying down, because your neck's not having to work to sit up. And then up on the other side and work the other side. What I'm finding actually is this left side's really tight on me. I should probably do a bit more work on that myself. So this is quite good for me. I'm finding out what's wrong with me whilst I'm trying to help you guys. So those are really, really, really nice. That's a great technique if people are having a bit of always having to clear their throat, especially as we start coming into allergy season. That's a really, really good one. And like say if you're desk bound, you're working in confined spaces and your head's all like this, or the absolutely famous texter's neck that we're all developing because we're all looking down and doing this. So that's really, really, really nice for that. So now I'm going to go and try and lie down and show you some of these techniques as we start to kind of work through some of the posterior portion of the neck. So I'm going to start with a couple of Mckenzie technique exercises. These are really good for people who have disky problems. They're not just for people with disc problems, but because they're safe enough for people with disc problems to use, I tend to give them out quite a lot because they're just really nice little mobilisations for the spine and for the discs, because unfortunately discs are not very well maintained with the body, but they don't get a very good blood supply. So if you're kind of stuck in one position at your desk like that, or long distance driving, it all kind of just dries up and gets a bit stiff. So Mckenzie exercises, which I'll show you in a wee second, are really, really good for that. So yeah, we'll just go and crack on with that. These two are so easy, you can do them in your bed, especially the first one. The second one you definitely kind of want to do dangling off your bed at home. So I'll just go show you two Mckenzie technique exercises. So with Mckenzie, like I say, it's all about mobilisation. You kind of want to almost imagine you're sliding one disc and one vertebrae on top of each other. So you've got a disc and a vertebrae, and you want to get them all lubricated and moving well. So to do that, you almost want to envisage this like pigeon bob type movement, but you're going to do it into the bed. So you're getting a little bit of gravity help with that as well. So bear this pigeon bob in mind. I know it looks a bit ridiculous, but as you get comfy in bed, you want to be nice and flat, no pillows or anything under your head, and what you want to do is like pigeon bob ceiling to bed. And like I say, that's just a really nice mobilisation for the neck, anterior to posterior. So as you pigeon bob down into the bed, you want to hold it for a couple of seconds and let it go, and then push down and let it go, push down and let it go. And it's just a really, really lovely little technique. You can kind of do like 10 reps of it, anything up to like 6 times a day. Normally for people with disc problems, you would kind of maybe get them to do it 4 to 6 times a day, 10 reps if they're able to, and kind of play it by ear. And then another one is dangling off the bed, so just be really careful. Anyone who's got low blood pressure or gets quite dizzy quite easily, just be really, really careful with this one. It might not be the best choice for you, but you can see how you get on with it. So what you're going to do with this one is shimmy yourself close to the edge of your bed and lie yourself down. Just make sure there's nothing behind you catching your head. Interlace your hands behind your head and just dangle off the back. And you want to kind of dangle there for about 30 seconds. After your 30 seconds of dangling, you just want to gently rotate your head left to right, no more than an inch to each side. And you're just getting a lovely open out through the front of that spine, as well as just getting a nice little translation through the vertebrae. Once you've done your 10 rotations side to side, interlace your hands behind your head again, and just take your time in sitting up. Don't sit up too quickly, because then you're going to get a head rush, and we don't want any of that, and no crazy blood pressures, please. So now we're going to move on to the posterior aspects of the neck. Get my little Shakti pillow. You can also use a foam roller for this, is really good too. But I really, really love my Shakti pillow these days. So I will quickly show you it with a roller, but I really like this. So like I say, you'll be able to find this on Amazon. Not getting any commission for this, I just really, really like it. So again, lying on the floor, lying on the couch, lying in bed, whatever is comfiest for yourself. It's not for the faint-hearted, I'm not going to lie, but it's really, really nice. And all you can just do is just let your head and top of your neck sink into it. You can lie there kind of as long as you really need, and basically what the Shakti mat is going to do is apply a gentle acupressure to the muscles at the back of the neck. What you can do instead of, if you want to lie there for a little while, you can then make it a bit more of an active movement, and you can just really subtly, I hope you guys can see that, just tuck your chin to your chest and take your chin to the ceiling, and you get a really nice little acupressure all through that high up section. And then you can also do a little roll of your head side to side, and that just works through a little bit more of the skull and into the scalp. And that's just a really lovely technique for all those little suboccipital muscles and a little bit of that fascia that comes up and over your head. So that's a really nice little technique too. Moving on from hold on, I'll quickly show you with the roller too. Just works the exact same. Unfortunately, I've loaned my other roller out, so we just have to use a really big one. It's the exact same. Just use this one on the floor. Just gently head on the roller, and you can do the same thing. You can just lie there, let the roller take your weight, and then you can just do a really gentle chin to chest. Let the roller work through all those little yucky bits. Those are the really scientific words for myofascial adhesions. Yucky, gungy. Everybody who works with me knows that I like to use buzzwords like that. And then you can just do little side rolls, and that's lovely too. And then to be a bit more specific, you can start using spiky ball and Franklin ball. I actually meant to show you earlier, Franklin ball is super good for your face. So it's a little bit different from the spiky ball. Spiky ball's got all these little nodules on it. Franklin ball has these little dimpled surfaces. And what that does, acts like a little sucker. So as you start rolling it across the skin, it basically just gently peels the tissue away from the tissue below. You get a really good oxygen supply in there. It helps flush blood through, flush out any rubbish that's been accumulating in whatever part of the body you want to work it on. Great for tummy work. I'll show you that in a couple of videos time. So that's actually a really good one for all the facial stuff before you start doing the knuckling. Not quite so good for posterior stuff, but really good for all this anterior work. So I meant to mention that earlier. So when you're doing the whole front, definitely Franklin ball, forehead, cheeks, around the chin, side of neck, anterior neck, a great little opener. But spiky ball for the back of head, you can use it very similarly to the Shakti mat pillow and the foam roller. Just don't go directly on the spine, just kind of go, where's Sid's head? Kind of all like around this area, but not directly, kind of here and downwards, so just all kind of around there. And then you can just do a little bit kind of across the top, just across top of the shoulder blades, and do some arm mobilizations, which I'll just quickly show you just now. So, like say, you put this under your head, and just the same as a foam roller, you can just be a little bit more specific. You can just find one particular little gungy bit and move your head across it. But if you want to tackle things like levator scapulae, some like neck muscles that affect into the shoulder, you take the spiky ball and take it just across the ridge of that shoulder blade. You can just sink into it and let it basically trigger point or do some acupressure points to it. Then you can also start moving the arm. You can then hold it and start moving the neck, whether that's chin to chest or up and down or side to side, and that'll just help tackle little bits along there too. Like say the shoulder mobilizations with it is quite nice too, whether it's up or down or some circumduction, some medial and lateral rotation. That's all really nice for that. And you can do that to both sides. And I think that's kind of it. I think I've probably warbled on quite enough, so I hope you guys have found that interesting and informative, and hopefully you guys can do some self-rehab while you're self-isolating, and you enjoyed that. So please drop me a DM, good, bad, indifferent. Just don't be too mean about it, please. And any questions you want me to try and answer privately, and I can maybe add things to videos coming up. So I hope you enjoyed that, and I'll maybe see you next week. Bye, thanks for listening.